Hi everyone, I want to take a minute here and talk about this tragic case of a plastic surgeon operating on his wife who apparently had a cardiac arrest. They said it was lidocaine toxicity. It may have been something else, and I want to touch on that for just a minute. She was having an awake major procedure. There's been a lot of talk out there, a lot of more plastic surgeons and non-plastic surgeons offering awake plastic surgery. I want to talk about what that really is. In most of the cases, these patients are awake and they're receiving numbing medicine. But in many of these cases, there's more than that going on. And in those cases, a lot of them are receiving what we call conscious sedation. In other words, numbing medicine alone is difficult to numb the area. Patients continue to have pain, especially as you remove that numbing medicine with liposuction. As a result, surgeons ahead of the procedure will give the patient pain medicine and oftentimes something for anxiety like Valium. When you give a pain medicine and an anxiety medicine together, we have what's called conscious sedation. Conscious sedation requires monitoring in terms of monitoring your vital signs and breathing because you can stop breathing. I believe that may have been what had happened in this situation. When the cumulative effects of the medicines interact with the numbing medicine, it can lead to respiratory arrest and stopping breathing and then cardiac arrest. In those situations, even if 911 services are called, usually the patients are going to die because of the delay in treatment. No surgeon is trained to do anesthesia. They may have some basic equipment to help with breathing, but most of the time if they're doing these procedures without the board-certified anesthesiologist present, there is nobody to protect your airway. The highest, best trained people in the world are not there to help you, and you're going to have somebody who has no training to try to save your life. Right? That is usually going to end poorly. That's why it's critical that we not only have a board-certified plastic surgeon, but a board-certified anesthesiologist present. A lot of these awake plastic surgery procedures are being offered because board-certified anesthesiologists will not work with someone doing plastic surgery unless they are a board-certified plastic surgeon for the vast majority of cases. They're not going to risk their license and their liability to work with somebody who's not trained. Therefore, the only option that a lot of these doctors have, or these surgeons or cosmetic surgeons, whoever they are, is to provide awake procedures. They will claim that it is safer, but as we know, not having a board-certified anesthesiologist and a board-certified plastic surgeon present is the most dangerous combination for any major procedure. The other reason we're seeing these awake liposuction procedures, and even in the cases of board-certified plastic surgeons, is because surgeons who feel like they have to offer cheaper surgery in order to compete will eliminate an anesthesiologist from being present and offer a procedure awake, hoping that they'll get more patients because perhaps the patients won't pay what's actually required to do the procedure. Guys, don't risk your life. It's not worth it. You can't save a few bucks and risk safety. Make sure that if you're having a major procedure, and guess what? Liposuction is a major procedure, that you have a board-certified plastic surgeon doing a procedure and a board-certified anesthesiologist present. That way, if there are complications, your life will be saved. That patient could have easily had a breathing tube inserted and no problems would have arisen if a board-certified anesthesiologist was present. I'm not saying you won't have any complications or that everything's 100%, but you are taking the basic steps needed for your safety. Make sure that you're seeing a board-certified plastic surgeon and board-certified anesthesiologist when you look for your plastic surgery procedure. Have a great day.